My job has changed in many ways since COVID-19 started back in March when we closed the school down. So I'm used to being here 4 days a week, and all of a sudden I was at home trying to be a school nurse. So really just trying to help us figure out how to reopen the school when we thought we may be going back, which was very hard to predict given everything that was going on at the time. So I became an at-home school nurse with my 3 children at home, and then worked through the summer. I came in to help get everything started. So trying to figure out the spacing for the students, the safety for the students, and more importantly, the safety for the faculty and staff. I'm not assessing students as much as I normally would now that we're back at school. It's more just seeing students when they have an emergency. Or seeing faculty and staff a lot more than I normally would because everyone's anxiety is so much higher. We have most of our students on campus, but I'm seeing a lot less than I normally would because the teachers are handling a lot in the class. My fears were, when would we know more concrete evidence of what was going on with COVID-19? And also, how could we keep everyone safe in a closed environment? I think now we know so much more. We're doing testing all the time, and we just know so much more about how the process works. We're all wearing masks. We're staying 6 feet apart, so we know so much more with evidence, and so we're able to kind of figure out how to treat the problem and stay safe. And I think that'll keep changing as the vaccine comes out. I think my job will be as it is right now for the next, I'd say at least a year. Maybe longer. I think, hopefully we'll have our students back in, and hopefully I'll start seeing kids for Bandaids and bug bites and losing their teeth, and for the reasons I love seeing the smiles on their faces, and that's super hard now that I can't see their faces and their smiles as much. So I look forward to getting back to normal at some point, but I think it will stay like this for a while longer. So in the beginning, we had a lot to work through those first 2 weeks before the students were on campus, with temperature checking, with less of a student body here, doing temperatures early in the morning, trying to figure out a process for ways lunch were distributed, or ways teachers got breaks, or how we brought a student into the health office. We worked through those processes and we've figured it out. And I think we'll keep figuring it out as everything continues to change.